lecture of the National Web Lecture Series 1 entitled Pandemic Introspections from Varied Perspectives, organized by the Department of Political Science in collaboration with the IQSE of Government General Degree College, Shingur. I now request Professor Choitali Choudhury, Coordinator of the IQSE of Government General Degree College, Shingur, to say a few words.
Good evening. The COVID-19 outbreak has far-reaching consequences apart from its infectivity. Future history will narrate the inferences of this period in a more comprehensive way. But that much we can apprehend that there must be the wide range of long-term consequences of this pandemic which the world will face. For India also, it is a challenge to mitigate the spread of the infection, to keep the economy in balance, to make sure that the social life of people doesn't go out of order, and to develop the health system so that the disease can be combated. Different state governments have responded to the COVID-19 quite seriously and are doing their best to take the situation under control. Though we were not ready for such an unprecedented situation. Our today's speaker, Dr. Arun Kanti Jana, Professor, Department of Political Science, North Bengal University, will discuss on this topic. On behalf of IQSE, I welcome you, sir, in this National Web Lecture Series organized by Department of Political Science, Government General Degree College, Shingur. Thank you.
Thank you, Professor Choitali Choudhury. Our speaker for today's lecture is Dr. Arun Kanti Jana. He is a professor in the Department of Political Science at the University of North Bengal. He has contributed several articles to various journals and book chapters to edited books. He co-edited Class, Ideology and Political Parties in India, published in 2002 with Professor Bhupen Sharma, and Development and Disorder, The Crisis in Governance in the Northeast and East of India, published in 2010 with Professor Maya Ghosh. He has also presented papers in several international and national conferences and seminars. His areas of interest includes political economy of development, Indian political economy, identity politics, social movements, state politics, and political parties. Apart from his subject, Professor Jana also takes interest in philosophy, history, and literature classics. In 2008, he was awarded the Manush Chatterjee Award of Excellence in Research on Regional Science in the annual Indian Regional Science Association Conference. Today, he will be speaking on of COVID-19 pandemic and state response in India.
Now, in this lecture, I am going to talk about the COVID-19 pandemic and state in India. I have, in fact, given the title like this of COVID-19 pandemic and state in India. Now, I will talk about several aspects of the COVID-19 pandemic. First, I will talk about, say, what the pandemic is all about, though I am not a virologist or an epidemiologist. And then I will talk about the extent of the pandemic, that is second. And then I will be mainly concerned with the question of state response. Okay, now the state response particularly in this country. Now, the COVID 19 pandemic is best described as a global human crisis which is in fact devastating the world. It is unprecedented in human history that we all know. Any disaster, including the Spanish flu of 1918, which infected 500 million people and claimed about 20 million lives, it did not affect so many countries. Now, if you look at the countries which were infected during the Spanish flu, you find that not many countries were infected. European countries were in fact mainly infected. Okay, but so far as this pandemic is concerned, it had in fact affected many countries. Now, even the Second World War saw the death of about 70 million people, but did not involve every country in the world. The COVID 19, despite lower death rates than the war so far, it had disrupted what we call social lives and national economies in countries and regions of the world. Okay, say for example, the Second World War, it saw the death of about 70 what we call million people. Now, the pandemic crisis, it is in fact best summed up by a free reference website that is called the World Meters, which monitors COVID-19 round the clock. Now, according to its report, as of July 25th, 2020, the outbreak of the coronavirus, it has been confirmed in around 210 countries or territories. And the virus, it in fact had infected 16048,238 people worldwide, and the number of deaths have totaled around 6,64,000, 6.4 million people at that particular point of time. Now, there is a disturbing aspect of this particular, COVID-19 pandemic, and that is there are some people, those who are in fact saying that once somebody who had been infected by this particular virus, after his recovery, he may lose his immunity to the disease within months, with research suggesting that the virus could in fact reinfect people year after year like common colds. Now, India, as of July 25th, okay, there were 1382995 cases, okay, 467124 active infections, 883793 recoveries, and 32,078 deaths. It was placed in the third position in the world in terms of number of cases after the United States and Brazil. Now, in terms of total deaths, India has risen to what we call sixth spot, that is on July 25th. Okay, after USA, Brazil, UK, Mexico, and Italy. Okay. Now, when you look at today's newspaper, or when you look at the Statesman of 6/8/2020, you find it reports that the number of total cases in the country, they are 19,08,254. The active cases are 586,244. And the new cases were 52,509, and the total deaths were 39,795. And what is important is 857 people, they had succumbed to the disease in the last 24 hours. Now, last 24 hours would mean, say from the 4th of August till 8 a.m. till, say, what they call the 5th of August, 8 a.m. That is the case. Now, if you look at what they call the Statesman, okay, of today, that is dated 14th August 2020, you will find that it is talking about that the COVID tally is something like this. Say, for example, the total cases are 2,396,637. Active cases are 653,622, and new cases are 66,999. New recoveries are 56,383, and the total deaths, it is 47,033. That is, it's going to be around, say, 50,000 Okay, this is the report of the Union Health Ministry figures as of 8 a.m. Thursday, 13th August 2020. So therefore, you find that so far as this pandemic is concerned, it has made a huge impact, or it is widespread so far as this country is concerned. Now, at this rate, we cannot take, so far as this situation is concerned, very lightly. Say, for example, if you look at one prestigious institution's reports, say, for example, the Indian Institute of Science in Bangalore, it says that the number of infected cases will exceed 3.5 million by 1st September and could rise as high as 12 million, that is over 3 million active cases and a half a million fatalities by 1st of November. Okay, and the IISc study by a group of noted scientists, it says that by the new year on 1st January 2021, India would have possibly reached close to 30 million infected cases. Okay, India would have reached close to 30 million infected cases, over 6 million active cases and 1 million fatalities, and the pandemic is not expected to peak before March next year. Now, this is what the ISC, that is Indian Institute of Science, Bangalore study by a group of noted scientists, it is in fact talking about. So therefore, this is in fact a very horrible kind of a scenario. And so far as the international community is concerned, it anticipates a massive crisis which can spiral out of control and is closely watching India, which accounts for, say, around 1/6 of what we call the humanity. Okay, 1/6 of the humanity. Okay, so there are a few important points which is generally talked about regarding the spread of the pandemic in this country, and this must in fact be highlighted. The rate at which the infection is going up in India is in fact worrisome. This is the first important point. Second, there are many more infections that are to be counted beyond the official figures. Now, there are official figures, as we all know, that in third world countries, so far as the official figures are concerned, they may not be very accurate. That is one. So therefore, one must in fact look at beyond what we call the official figures. The vast cities like Mumbai and Delhi, Madras and Kolkata, they are in fact worst hit, but the pandemic is spreading to other cities and towns too, and lockdown is being reimposed in certain vertical areas. Now, the situation, it was absolutely bad so far as Delhi is concerned. Now, in Delhi, the situation is slightly better right at the moment. Slightly, it is improving right at the moment. The pandemic related issues, there is also the collateral effect on people's lives. The migrant laborers who are trying to get back to their homes are hard up, as once again the government has stopped the transportation, the trains as well as the bus services. There are some special trains which are in fact moving. The number of migrant workers, the fifth point is the number of migrant workers has also increased in Delhi. Most of them want to go back to their homes. The unemployment rate has drastically increased and many industries are refusing to take back their employees. And the grim reality in Delhi is that massive unemployment is leading to hunger, and this is posing a grave challenge than the COVID-19 situation. Okay, the government has announced huge schemes and everything, but on the ground, those schemes are yet to reach. If the health doesn't reach the people within the month, it will become very difficult to handle the situation. This is what people are in fact talking about. Now, overall, there is in fact a sharp increase of cases all over the country, and the epidemiologists and scientists are of opinion that the government needs to take a strong stand and admit that there is community transmission which is in fact taking place, which has to be seen, and there is in fact a need in order to check what we call community transmission. Otherwise, the situation will become much more worse in around 1 or maybe 2 months' time. So, and there are people, those who are in fact saying that given the number of cases, community transmission is surely happening. The active cases are concentrated in a few states, and although there is a steady increase of cases all over the country, the alarming increase is happening at present in a few states, and they too confined to a few districts. Perhaps the government does not want to scare the public by admitting there is in fact community transmission which is in fact taking place, and hence what you find is the government is in fact denying that any kind of community transmission is in fact taking. Then what you find is the fatality rate, so far as this country is concerned, it is not what they call very high compared to many other countries. This is what the government is in fact pointing it out. But at the same time, we must remain conscious, or we must be conscious about the fatality rate, because say around 47,000 people, they have till date, that is till the 14th of till the 13th of August, they have in fact succumbed to this particular disease, and it may in fact go up. So therefore, the fertility rates are in fact going up. So therefore, we will have to be very cautious about this. Proportionately, the number of infected cases is relatively low as of now as compared to the United States and Brazil. But the reality is that we are in a very precarious kind of a condition. So far as the health situation is concerned, so far as health infrastructure is concerned, it is not in fact very high standard. So therefore, there is in fact a possibility that it is in fact in a very alarming rate. So one problem is that which we have noticed, or which we in fact notice in this country, which is being reported in the newspapers, reported in the various what you call TV channels or the electronic media, which is in fact pointing it out, that people are not taking social distancing seriously in the far-flung regions of the country. So therefore, now these are the points which had been in fact pointed out to us by what you call by various people, and therefore there is in fact a possibility that the situation may become worse. We are in a precarious position. Things are getting worse, a lot worse, before they get any better, so far as this country is concerned. Now, coming to another important point relating to this particular pandemic, that is the origin of the virus. Now, what had happened, or how in fact the virus had originated? Now, there was in fact considerable debate, and so far as the debate or discussion is concerned, this debate in India also took place. It is taking place in the media, particularly in the electronic media, and regarding the question of the origin of the virus. Now, regarding the origin of the virus, there are some people, those who have in fact argued that they are convinced that the virus originated in a laboratory in Wuhan, that is in China, not in the Wuhan wet market. There are, however, what I find is few virologists who are in fact saying this. Most of them are of the opinion that it had come from animals. Now, those who believe in the lab origin theory, they are basically what we call the political pundits, led by Trump, and there are other people, those who belong to his administration, those who belong to his particular political party. Now, let us believe that a virus can originate anywhere in the world. The environmentalists, for example, they have in fact warned us, or they have been warning us, say, since long, that there is in fact a relationship between global warming, depletion of species, okay, and the emergence of new kind of viruses, particularly zoonotic viruses that are found in the body of animals. Now, this is what the environmentalists, they have been warning us since some time. This is something which we know it very well. Now, say for example, not many years ago, we heard about a virus, that is H1N1 virus, which originated in the Mexico, and this virus was found to be in the pigs, and it is said that so far as this virus is concerned, it was responsible for the death of around 2 lakh people throughout the world. Okay, and I am sure, if the environmentalists had to be believed, I am sure that the current COVID-19 is not in fact the last. There is again a possibility in future, okay, that we will have similar kind of outbreaks of epidemics and pandemics in the future, if we do not in fact change our pattern of living, if we do not in fact change the pattern in which we relate ourselves with nature, or the relationship that we have so far as nature is concerned. Okay, so therefore, to me, so far as the second theory is concerned, that the virus, it had in fact come, or the virus, it had in fact had originated uh, from animals, from the wet market Wuhan, in the Wuhan province. Now, this to me is something which is much more easier in order to establish. So there is in fact also a need to reinforce our thinking that there is in fact a need to change the manner in which we interact with nature. So therefore, what you find is that our pattern or our nature of interaction, so far as with nature is concerned, it must in fact undergo a massive change. Otherwise, there is in fact a possibility of many more what you call viruses. Now, you must have heard about a German sociologist, Ulrich Beck, who in fact termed the present global world as a risk society. He termed it in the 1980s, and the term, it got widespread popularity, particularly in the 1990s. And his terminology, it has become more relevant in the 21st century, especially in the context of the global consequence of the novel coronavirus. And he defines a risk society as that deals with hazards and insecurities induced by modernization itself in a systematic way. So therefore, Beck in fact wrote this, or Beck in fact talked about this, because he was extremely worried about the ill effects of modernity and ecological crisis. So according to Beck, human beings are always subjected to risks of natural hazards, but modernity causes severe human-induced risk to society in the form of pollution and other what we call health hazards. So therefore, this is so far as the origin of the virus is concerned. Now, now I will just briefly talk about what has been the global response to the coronavirus or COVID-19 till now. Now, coming to the question, that is, what is the response to the crisis by the nation states? Okay, now I find that there is no unified response as such. The response in different countries have been different. What can be claimed is that the response in countries which are democratic is different from the countries which do not have a democratic form or a system of government. Okay, the success which non-democratic countries had achieved is much more than that of the traditional established democracy. Say, for example, if you look at the success which China has achieved, or which Cuba has achieved, or say which North Korea has achieved, now that is a much more they have been much more successful in curbing, or they have been much more successful in containing the virus. Now, if you look at the established democracy, you find that they had not been so successful in curbing the virus. Say, for example, established democracies like UK, established democracies like USA, they had not been so what you call so successful. So therefore, democracy is in fact, it is not that democracy in fact can always be much more effective against in so far as fighting against a particular pandemic. Now, this is what, so far as our brief history of how we are looking at the pandemic, it in fact talks about. Now, what we find is that even though it is a pandemic, it has spread to more than 200 countries, more than 210 countries, in fact, in the world. Still, there is no unified attempt or effort at the world scale to fight the pandemic. Okay, now you will find that during 2008, when the great crisis, it in fact took place, that many of the countries of the many of the leaders of the summit of the group of 22, the world's richest countries, they in fact assembled, who are responsible for 80% of the global economy, in order to chalk out a program, in order to chalk out a program in order to come out of this particular crisis. But what we find is that there is no global effort which is visible in order to meet this pandemic. So therefore, the 2020 pandemic throws up a scenario where there is no leader, no united action to stop the spread. And even you find the WHO, it had in fact lamented particularly at this state of affairs at the international level. Okay, so therefore, what we note is that at the international level, there is in fact no global or world effort in order to control so far as this virus is concerned. Now that is something which is very shameful, and that is something which we notice. Even you find that the United Nations, okay, now forget about the WHO, even the United Nations, it had not been successful in in and in emerging in helping to emerge what you call a global kind of an effort in order to tackle the situation, in order to tackle the spread of this particular virus. So therefore, we are in a precarious condition where we are just thinking in terms of or where each and every countries are left to themselves in order to tackle this particular problem. Now that is the situation till now, so far as the containment of the virus at the international level is concerned. Now we come to the Indian state and corona. Now, on the question whether the Union government has done anything substantial or not, I would reply in the negative. The first corona case was detected on January 30th in Kerala this year. The Prime Minister declared a lockdown only on the 24th of March. He waited for the American President Donald Trump to visit India, that is one. And secondly, he waited also for the change in government in Madhya Pradesh. So therefore, he is acting very late. Now, what has been the role of Prime Minister till now? In other words, he announced a lockdown without giving much time for the people. That is something which is more important. He announced a lockdown without giving much time for the people to return to the respective places. As a result, the workers, those who are working in the unorganized sector, who have migrated, they suffered, and they have been suffered much more than what the refugees in this country had suffered after partition in 1947. And there is no parallel of this suffering in the history of this country. I am surprised that the government had no idea about the strength or about what they call the numerical strength of what they call the migrant workers. Now, there was more sensitivity. This is what we notice. And we can gauge this insensitivity of the Prime Minister from the simple fact that Narendra Modi, during the time of pandemic, he was in fact demanding discipline and sacrifice from the people, while he offered no fundamental measure to alleviate distress of those who have lost their dignity and livelihoods. He played some kind of a gimmick. Now, what kind of a gimmick it was? He said that the war which took place in Mahabharata, that is the war which took place in Kurukshetra, so far as this war is concerned, it was fought for 18 days and it was won in 18 days. And so far Corona is concerned, the war against Corona will be fought for 21 days and we will win the battle. Okay, but alas, even after what we call 5 months of his speech, there is no sign that the pandemic had in fact slowed down, and you find almost 50,000 people till now, they have in fact died, and there are many more infections which are in fact being recorded every day. Thus, the lockdown has resulted in what we call a massive loss of livelihoods, and the 70 crore strong unorganized workers is the worst hit. The fact remains that the nation failed during the point of time when the workers needed them most. These people, they sought a little assistance from the state, from the country, in their quest to reach their homeland, in order to reach what we call their humble abodes. But the country failed in order to provide them food and shelter. Now, this is in fact what happened. Now, it is well known that the unorganized sector, they constitute around 90% of the population of this country, a total workforce in this country. Now, if you look at the Arjun Sengupta committee report, which was published in 2007, which is in fact a lengthy document consisting of 397 pages, it points out that the unorganized workers, they constitute around 90% of the total workforce in the country. So therefore, the country or the Prime Minister or the government should have been more responsible. The government should have some idea that there are a large number of workers, those who have in fact migrated from their native places to different cities, to different towns, okay, in search of what we call livelihood. and these, so far as these workers are concerned, they will lose their job and they will in fact look for returning back to the native villages. Therefore, the government failed in this particular hour of crisis. The government failed in order to meet the aspirations of the workers, those who were thinking that so far as the state is concerned, the state will be able to provide them some kind of relief during this particular hour, particularly for reaching their humble abodes and also food and shelter. Now, the public focus on migrant labor, it in fact emerged almost as soon as the COVID-19 lockdown was announced on 24th March. Many poor workers who found they were without work and were short of funds, they took it upon themselves to walk to their villages, some with families, many more on their own. And there has been no count of the number of workers returning to their home states. An analysis of NSS data tells us that the first wave of returnees, they were in fact mainly urban casual workers who lost their livelihoods and lived in insecure accommodation. So therefore, we have witnessed what we have witnessed is the reverse migration and the pathetic condition faced by the migrant worker in the process. Thousands of migrant workmen started trekking hundreds of kilometers to their villages. At some point of time, it was reported that some workers they had walked, they have cycled for around for more than 600 kilometers in order to reach their villages, and in the process they have also met different kind of accidents, etc. That the whole country is the whole world, not only the country, it is aware of. So therefore, the sudden lockdown throughout the country, it generated insecurity in the minds of the migrant workmen, mostly who are working in the unorganized employment, such as shop assistants, security guards, cooks, and other casual jobs. Now, there is no record, in fact, maintained, not even by the government, with regard to the particulars of such migrant workers by any of their employers. Now, so therefore, there are certain laws, but so far as these laws are concerned, these laws didn't operate at this particular point of time. Now, it is argued that the lack of uniform development throughout the country, deficit rainfall in certain areas, it in fact adversely affected agricultural activities and it stimulated the migration of labor to the urban areas. যারা স্টুডেন্টসরা যারা বাংলাতে ইংলিশে খুব কমফোর্টেবল নাও, তোমাদের একটু বাংলা খুব দরকার, আমি একটু বলি, বাংলাতে বলার চেষ্টা করি। সেটা হচ্ছে যে দ্য প্রাইম মিনিস্টার অফ দিস কান্ট্রি মানে হি ইনফ্যাক্ট অ্যানাউন্সড এ লকডাউন very hurriedly. He announced a lockdown in March 24. It was delayed. দেরি করে লকডাউনটা অ্যানাউন্স করা হয়েছিল, অ্যান্ড অ্যানাউন্স করার পরেও দের ওয়াজ নো টাইম দেওয়া হয়নি। যারা মাইগ্রেন্ট লেবারার্স, যারা বিভিন্ন workforce, those who are working in different unorganized sectors, they in fact found it difficult to retain and they had to face a large number of problems. ওদের অনেক প্রকারের অসুবিধা ফেস করতে হয়েছিল, and even এখনো ফেস করতে হচ্ছে। Now, the largest employer of the migrant workers is the construction sector. Domestic work, textile, industries, bricklane workers working in transportation sector, mines and quarries and agriculture. And most of them, they are in fact managed by private labor contractors. Now, the migrant workers you can classify into two main categories. ওদেরকে দু ভাগে ভাগ করা যায়। First, those who are engaged or those who are working in any establishment wherein 5 or more workmen are engaged, যারা কাজ করে এমন একটা এস্টাবলিশমেন্টে যেখানে 5 জন or 5 জনের বেশি কাজ করে, that is one. Second, those who are working in petty business and jobs, যারা ছোট ছোট বিজনেস সেক্টরে কিংবা চাকরিতে আছেন। These migrant workers are the most vulnerable groups and subjected to opportunistic indifference. Okay, and the private contractors or any other like sources of agencies are not duly identified in case of those migrant workmen falling in the later category. So therefore what you find is that so far as the migrant workers are concerned, they are basically two different kinds. Okay, those who are working in factories or establishments where there are more than five workers, those who are engaged, and secondly, people those who are working, or workmen those who are working in those kind of employment where they are alone, or where there are only a few people those who are working. So therefore there is a difference between these two different categories of workers. এদের মধ্যে একটা পার্থক্য আছে। ওকে, ইভেন এদের মধ্যে একটা পার্থক্য আছে। যারা ফার্স্ট ক্যাটেগরি ওরা স্লাইটলি বেটার, যারা সেকেন্ড ক্যাটেগরি দে আর স্লাইটলি দে আর what you call worse when it they are what you call worse so far as the economic condition is concerned. Now what exactly will happen, okay, as a result of this reverse migration? কি হতে পারে এই রিভার্স মাইগ্রেশনের ফলে কি এক্স্যাক্টলি হতে পারে? There will be increase in unemployment, which was very high even before the arrival of corona, or even before corona appeared in the scene. Secondly, many of the small and medium scale industries which are located in different parts of the country, they will shut down because of loss of labor. Okay, since there is no labor, or since there is not much labor left, okay, because many of the industries they required some kind of a skilled labor. So since these people they have left to their villages, so therefore you find many of the small scale industries which are located in the towns, which are located in the cities, they will in fact close down for quite some time, or maybe forever, because they depend on this labor force. And thirdly, agricultural wages are likely to go down, okay, in the countryside, since the labor force will look for employment in the agricultural sector. So therefore there will be a reserve army of agricultural labor in the countryside who will be looking for employment, and as a result of which you will find that the agricultural wages are likely to come down. এগ্রিকালচার চাষি যারা চাষ সঙ্গে রিলেটেড এই ওয়েজটা কিছুটা কমে যাবে। Okay, so therefore this is the third impact which is in fact going to happen as a result of what you call migration, as a result of what you call reverse migration that is in fact taken down. So lockdown though was in fact necessary, nobody will deny that lockdown was not necessary. Lockdown though was in fact necessary, but it was not in fact planned by the central government. Okay, it was declared hurriedly, that is one. Secondly, no time was given in order to so that people those who are in different parts of the country they return to their villages. So as a result you find that people in fact suffered, migrant laborers in fact suffered. Okay, and see this process or this phenomena is something which is comparable to, okay, of a process which we have witnessed after partition in 1947. Now what is the package? There was in fact a package which was announced by the union government at this particular point of time when the workers they were returning back. It was not in fact a recovery package. It does not in fact look like a recovery package. It looked like another budget which was in fact announced. The only good thing which I in fact find so far as in this recovery package is concerned is that the allocation for MGNRAGA, it was in fact increased. Okay, that was necessary. That was necessary because of one reason. I have told you that so far as the laboring population is concerned, the migrant laborers are concerned, they have returned back to their villages, and because they have returned back to the villages, they will look for work in the rural areas, and when they look for work in the rural areas, so there will be a requirement for what? There will be a requirement for job, and they can be absorbed under what we call the NRAGA. Okay, so the package which the government it in fact had announced recently, or which it announced in the month of June, will not provide any kind of relief to the unorganized workers. Whatever they are supposed to get, they will get only in the form of loans. Now that is what was laid down so far as the package is concerned. Okay, so therefore the union should address all these problems immediately. There are certain problems which the state governments are facing in the fight against corona. Now that is there are shortage of many essential items at this point of time in hospitals and other logistics. The union should address to all these problems immediately. Announcement, lectures, propagation of superstitions, it will in fact not work. Okay, now to my mind, James Keynes had given a suggestion long back for the revival of Europe during the time when Europe was hit by the Great Depression, and you find that was in the 1930s, and probably John Maynard Keynes, he has been forgotten. Okay, to my mind, the leadership needs to put all other government business aside and begin to work on controlling the pandemic and saving human lives. Now, that is the reason why the state exists. The state exists in order to protect the life of the people. The state exists in order to protect, in order to provide individual security. Okay, that is something which is in fact not happening, or that is something which is in fact not happening so far as at this particular point of time, or there are several lapses at this particular point of time. So all the resources which are available with the central government, it must be deployed to this end, and India's credibility as a democracy or as a democratic country is at a stake here. Okay, so therefore the government, to me, it is supposed mainly to act on two fronts. Now, which are the two fronts? First, containing the spread and treatment of coronavirus, that is one. You will have to contain the spread and the treatment of the patients of coronavirus, that is one. Secondly, the government will have to provide alternative source of employment to the people who have lost their jobs. Okay, so therefore the government will have to fight on two fronts. First, it will have to contain the virus. It will have to cure the people, those who have been infected. That is one. Secondly, the government will have to provide what you call alternative source of employment to the people who have lost their jobs. Okay, so therefore this is what we find, that there is in fact a lack so far as the union government is concerned. Now, if the union government is not doing much, okay, who are the others, or who is doing, who are in fact working in this particular front? What I notice is that it is not the union government, it is rather what you call the state governments in the respective states who are actually fighting the war against corona. Okay, in India. So, I mean, the state health officials, the doctors, the nurses, also the police personnel, administration, etc. They are actually fighting the coronavirus. They are actually fighting in the battlefield. The center or the union's role is the role of a facilitator. And when we look at this particular role, we find that there is in fact a lack. There is in fact a great gap between expectations and what actually the union government is doing. A national emergency has not been declared, where the powers are taken over by the union. The army or the paramilitary forces have not been called even till now, except in some places. I hear it is in Gujarat. So under this situation, where the state governments are the main actors or warriors, one cannot claim that it is the prime minister, or one cannot claim that it is the union who is in fact fighting so far as the war is concerned. Okay, so আমরা যদি দেখি যে অ্যাকচুয়ালি ওয়ারটা কে ফাইট করছে, ওকে, at the ground level, so you will find it is not the union, মানে এটা সেন্ট্রাল গভর্নমেন্ট বেশি কিছু করছে না কিংবা করতে পারছে না। এটা the fight is between what you call this it is by what you call the state government. State governmentই বেশি কাজ করতে হচ্ছে। State health officials, okay, state police, doctors, nurses, the police personnel, administration, they are actually working. It is not what you call the union government. The union government is supposed to play the role of a facilitator. Facilitate করার কথা, কিন্তু ওইখানেও আমরা খুব বেশি দেখছি না। So therefore, yes, it is the limited abilities of the state government and resources. It is with this limited abilities and resources of the state government, you find that it is the state government which is in fact in the forefront. Whoever is in fact ruling those states, that is something immaterial here at this particular point of time. Okay, because we don't have much medical colleges which is owned by the union. Okay, there are very few medical colleges which is owned by the center. Okay, some years ago you find some IIMS, All India Institute of Medical Science, they were established along with some IITs in the country. Okay, but later on you find I don't see much happening so far as in this front is concerned. So therefore, healthcare, it is basically is maintained by the state government. Okay, and because healthcare is basically under the state government, healthcare appears to have been healthcare is in fact in a bad shape because of resources, mainly because of inadequate resources. Hence, you find that after the after what you call 1980s, 1990s, you find healthcare, it has been left mainly to the private sector, a drift towards what you call the American system and not to the British system. So therefore, this is what you call the situation. So what I see is that India just spends a little over 1% of its GDP on public health despite an increase in health expenditure since 2009, according to the latest National Health Profile data. Okay, this is the latest National Health Profile data, that it spends slightly more than 1% of the GDP for health related purpose. Now, the annual data released by the government, okay, it says that India spent only 1.28% of its GDP in 2017-18 financial year as public expenditure on health. The figure was 1.02% of the GDP in 2006 to 16 to 17. Okay, so into 16 to 17 it was 1.02% of the GDP. It increased slightly to 1.28%. Whereas you find the Narendra Modi government, it has announced to raise expenditure on public health services to 2.5% of the country's GDP by 2025. So this is a very, this is something which is in fact a very negligible percentage of the GDP which is being spent so far as the health sector is concerned. Okay, even if you look at many of the Western countries, you will find many of the Western, not only the Western countries, but you will find many of the countries which are located in the third world, they spend more than what India spends so far as education is concerned, so far as health is concerned. The United States spends the most on public health, that is 18% of its GDP, which is over US dollar 10,000, nearly rupees 70,000 per person a year. Okay, the US system is purely a private system, but at the same time, you will find that the expenditure by the American government on health, it is much higher. It is the highest so far as this country is concerned, so far as this world is concerned. Whereas when you compare it with that of India, you find India, it spends a very negligible amount, that is just 1.28% of its GDP so far as health is concerned. Now, this is in fact not sufficient in order to meet the requirement of pandemic. Okay, not even what they call a smaller epidemic, which in fact takes place, which in fact may crop up at any point of time. The NHP data also shows that the cost of treatment, it has been on the rise in India, which has led to inequality in access to healthcare services. Okay. As I have told earlier, that there is another front in which the battle has to be fought so far as this country is concerned. Now, the front is that of providing alternative employment to those who have lost their jobs. We were talking about what they call the migrant workers, those who have migrated from the towns, the cities to their respective villages. Now, during the period when the reverse migration in fact was taking place, Development Research Institute Bhubaneswar, a research institute of Gaveshna Chakra, it came out with certain suggestions or certain measures which to me are very interesting. It suggested certain immediate measures. Now, what are these immediate measures? In the context of Odisha, which included, to me, these immediate measures are very interesting. First, it talked about food security. Okay, that is, to avoid any possibilities of food insecurity, universal PDS with a minimum of 10 kilogram wheat, rice per person, okay, per month, and other essential food items shall be made available, such as pulses, oil, soaps, and sugar should be provided to all households, or at least to the eligible households for a reasonable length of time. This is the first suggestion which they in fact gave. Second, they talked about cash transfers. The cash transfers initiated by the government, okay, though an important step, was inadequate both in terms of the amount of cash transfer and the number of people covered. Okay, and the number of people covered. Now, given the continued hardships faced by a vast section of the society, a cash transfer of rupees 7,500 to households for the next 6 months. This is second. Third, regularization of membership of construction workers. Fourth, enhanced transfers to other vulnerable sections. Fifth, support to migrant workers. Okay, the state government has a database of workers who have returned to the state. Okay, the list should be expanded and updated. Okay, there are many people, those who have returned to the state. The list must be expanded and it in fact must be updated. Sixth, human health rights of migrant workers and others must be protected. Okay, now these are some of the measures which in fact were in fact suggested by the Gaveshana Chakra, that is the research institute which is located in Bhubaneswar, regarding what it should do in fact in order to contain the situation in the second front. The second front is providing alternative employment to workers, those who have returned back to their villages. Now, coming to the NREGA, that is National Rural Employment Guarantee Act, what role can NREGA play here? The NREGA scheme can save the laborers who have migrated. It can in fact save the laborers who have migrated. But how can it do that? Okay, now as I have said earlier, that because it is in fact a phenomena of reverse migration, that is, there are workers, those who have migrated from the villages in search of employment, okay, in the towns, in the cities, and so far as these workers are concerned, these workers, they have left the towns and the cities, they have come back once again to the villages, okay, and if they don't go back, I have heard that some of them, they have gone back, they have returned, even though there is a fear of corona, getting infected by corona, they have returned. Okay, still you find a large workforce have returned to their villages, and so far as these villages are concerned, they are crowded in their own villages. So therefore, the NREGA, which in fact looks at, or which in fact talks about providing employment to the villagers, to what you call in the rural areas, they will have to absorb, or they will have, it has a role to play here, because it will have to provide job to not only to the existing workers or the workers, those who were there all there in the villages, but also to the workers, those who have in fact came back, those who have in fact migrated back to their villages. Okay, so what we notice is that even though the UPA government, it has given a lot of importance to NREGA, but so far as the Modi government is concerned, it was not willing to give importance to the NREGA in the beginning. There were several places, or there were several times when the Modi government, it in fact thought in terms of reducing what you call the allocation to the NREGA, because it didn't wanted to continue it didn't expand the scope of NREGA. So therefore, there is in fact a necessity in order to expand the scope of NREGA. That is one. Secondly, there is in fact a necessity in order to provide more and more funds to the NREGA, so that the 70 crores hapless workers or workforce, those who have returned to the villages, they get what you call employment for whatever number of days are concerned in the NREGA scheme. Now, in the wake of the lockdown, what we notice is when laborers, they started fleeing the cities, they started returning back to the cities. Okay, state government, especially the Chief Minister of Bihar and Uttar Pradesh, they had in fact promised to provide jobs to the laborers that suited to their skills, because most of the migrant workers, they had some skills. Okay, but soon it became clear that they were not fully equipped to keep their promises, and eventually, even the skilled were made to do Narega jobs. Okay, even the skilled, they were asked to do the jobs, unskilled jobs under the Narega provisions. Now, skilled laborers, they were supposed to dig the canals and do earthwork. Okay, and the Narega served the purpose of mere survival. Okay, it cannot give them more, but it serves the purpose of survival. But what was worse, the money, the wages could not help them purchase the essentials for their survival. Okay, now that is what in fact is happening. The monsoon session is going, monsoon, what you call season, is at its peak. Okay, so therefore, this particular scheme, it has to be strengthened, it has to be more strengthened, so that people get relief, so that the migrant workers, they in fact get relief. And what you find is, as usual, the Prime Minister Narendra Modi, he resorted to his populist politics. He launched the Garib Kalyan Rojgar Abhiyan via video conference in Katihar village in Bihar, in the presence of Chief Minister of States. Now they were the Chief Ministers of Bihar, Madhya Pradesh, Uttar Pradesh, Rajasthan, Jharkhand, and Minister of Odisha. The scheme was to work in a mission mode in 116 districts across these 6 states, because these are the districts from which there is a maximum number of migration of workers. But this scheme is nothing but a paper tiger. It has in fact failed to reach the concerned people. Now this is what is found. So therefore, the government has in fact failed. It was primarily responsible for the moving back to the cities, which ironically had exploited, misbehaved with them, and ill-treated them. Okay, the government was supposed to provide them relief, but ironically what had happened is the government had in fact failed. It had failed in order to provide, it had in fact misbehaved with them, it had in fact exploited them, it had in fact ill-treated them. Okay, a large number of laborers went back to the cities even after facing the grave danger of being infected with the coronavirus. Now, that is what in fact the situation so far as the countryside is concerned. Okay, the laborers, they had in fact come back to the countryside, nursing the view that they would earn their livelihood in their native places and live with their families. Okay, but they had to confront a situation where the states had failed to develop to take care of their people. Okay, so therefore you find they are in a bad condition. Okay, and therefore what you find is many of what you call the migrant workers, they have in fact returned back to the towns or to the cities with the help of what you call the petty contractors, even though there is a risk that there is always a possibility of catching corona or getting infected by corona. Okay, and what you find is that several states, they were anti-labor in their character. Okay, particularly Madhya Pradesh, Haryana, Uttar Pradesh, it promulgated ordinances freezing for 3 years the enforcement of central labor laws on wage hikes, working hours, and worker welfare to attract what you call investments. True enough, this was done only for giving more flexibility to investors, but also making firings easier for smaller employees. Now that is what in fact happened so far as some states are concerned. And even the chambers in fact suggested increasing working hours to 12 a day, without which they said the industry won't in fact function. Hence, what we find is that the situation till now, so far is concerned, it is in fact precarious. There is a question which in fact arises. Who will benefit if employers are given even more freedom to hire and fire? The problem is not in the laws, it is in the mindset of those who advocate such reforms. Now, if you give them more power, then definitely what will happen is the unorganized labor force, the migrant labor force, they are likely to suffer. Okay, so in some states that is what in fact had happened. Okay, and we also note that in some states the union government has not been doing cash transfer to the laborers in right spirit and manner. Okay, astonishingly, the government was also not expanding NRGA in rural areas and introducing an employment guarantee program in urban areas respectively. At present, Narega is availed of only for 50 days, okay, of employment, although the Act guarantees 100 days of employment. Now, that is in fact the real situation so far as Narega is concerned. So one way to help the poor and informal workers is to strengthen it. Okay, though there are two proposals. First, to increase the number of days under the scheme from 100 to 150 in rural areas, and second, to introduce an employment guarantee act in urban areas and provide employment for 150 days. Okay, but this was not being done on the pretext that fund involved is quite high, okay, or quite huge. So therefore you find that what was expected from so far from the government is concerned, from the union is concerned, now that has in fact not taken place till now. Okay, but still let us hope that so far as the Narega is concerned, it will help, but certainly not the entire workforce. A huge proportion of laborers will be exposed to hunger very soon. Okay, they have been exposed to hunger and they will be exposed to more hunger. So therefore, there is in fact a requirement to strengthen the health system. That is first, to strengthen the health system, increase in health expenditure for the construction of health facilities in the country. Okay, facilities in the state governments, within the states. Okay, providing more resources to the states so that the states are able to handle the situation, okay, or improve their infrastructure. And second, increase the scope of NREGA, okay, scheme for the labor force that has lost their job, and other employment guarantee scheme for the urban areas. তো তার মানে হচ্ছে দুটো জিনিস স্টেটকে করতে হবে। প্রথম, এক্সপেন্ডিচার, খরচ হেলথ সেক্টরে অনেক বাড়াতে হবে, ওকে, সো দ্যাট ইনফ্রাস্ট্রাকচার আরও বাড়াতে হবে, পরিকাঠামো আরও বাড়াতে হবে in the countryside, in the states, etc. States মানে রাজ্যগুলিকে অনেক বেশি টাকা, অনেক বেশি দিতে হবে, দ্যাট ইজ ওয়ান। আর দ্বিতীয়ত, স্কোপ অফ নারেগাকে বাড়াতে হবে, আর এমপ্লয়মেন্ট গ্যারেন্টি স্কিম ইন দ্য আরবান এরিয়াস নিয়ে আসতে হবে। না হলে সো ফার দ্য মাইগ্রেন্ট যারা ওয়ার্কার ফিরে এসছে, they will have problems, they will be suffering from hunger, they are already suffering from hunger, they are having problems, কিন্তু আরও বেশি বেড়ে যাবে যদি এটা না করা হয়। থ্যাংক ইউ।
Thank you, Professor Arun Kanti Jana sir, for your insightful, analytical and thoughtful presentation of COVID-19 pandemic and state response in India. Professor Jana, in his speech, has analyzed several aspects of COVID-19 pandemic and pointed out the shortcomings of the state in dealing with this situation in India. He also made some recommendations through which Indian state can provide better assistance to the laborer of the unorganized sector, especially to the migrant laborer. Thank you, sir, for your valuable speech. We are enriched. With this, I would like to thank our principal sir, Dr. Shantanu Chakraborty, who always encourages us for organizing this web lecture series, and to thank our IQAC coordinator and HOD of History Department, Dr. Choitali Chaudhary, who always gives us all kinds of cooperation and advice for organizing this web lecture series. To all the participants of today's event who made this national level web lecture series a grand success. I am to thank all the professors of our college for their active support, encouragement and participation in today's lecture series program. Special thanks to Shoikat Bandyopadhyay, Assistant Professor of Philosophy Department, GGTC Shingur, for his special technical assistance. I would also like to thank our HOD, coordinator of this national level web lecture series 1, and Associate Professor Gargi Mukhopadhyay for coordinating this web lecture series. Last but not the least, thanks and lots of love to our dear students whose participation is our inspiration. With this vote of thanks, we conclude today's session, and until next time, goodbye and good night.